Have you ever received unexpected news after a routine health checkup, leaving you with a mix of worry and confusion? When it comes to cervical screening, often called a Pap test, an abnormal result does not automatically mean you have cancer or even serious disease. In fact, many non-cancerous or benign factors can lead to an unusual finding, which is important to understand for your peace of mind and health. The reason for this lies in the way a Pap test works. It examines cells from your cervix for any changes. These cells are highly sensitive to various influences, so even minor, temporary irritations or infections can alter their appearance under a microscope. Your body is always working hard to protect itself, and sometimes these normal responses can look like something else on a test. For instance, inflammation from a common infection might make cells look slightly different without being precancerous. Several everyday situations can contribute to these benign abnormal results. Things like certain infections, such as a yeast infection, bacterial vaginosis, or trichomoniasis, can cause changes in cervical cells. Hormonal shifts during pregnancy or menopause can also influence cell appearance. Even recent sexual activity or irritation from certain hygiene products or lubricants used shortly before your screening can affect the results. Sometimes, benign growths like cervical polyps or cysts are present, which are not cancerous but can show up on the test. Knowing this can help you approach your follow-up with less anxiety. If you receive an abnormal Pap test result, it is a cue to have a calm conversation with your doctor. They might recommend further investigation, such as a colposcopy, which is a closer look at your cervix, or a repeat Pap test in a few months. Remember to always discuss any concerns you have with your healthcare provider. A very common benign finding is called a ASC-US, which stands for atypical squamous cells of undetermined significance. This simply means there are some minor cell changes that are not clearly normal but also not clearly abnormal, and they are usually not serious. Understanding that squamous cells are the flat, thin cells on the surface of your cervix and glandular cells are the column-shaped cells found in the opening of your cervix helps demystify what your doctor is looking for. This deeper knowledge empowers you to ask informed questions and participate actively in your healthcare decisions. Ultimately, an abnormal cervical screening result, particularly one due to benign causes, is an opportunity to be proactive about your health rather than a cause for immediate alarm. It highlights the importance of regular screenings and open communication with your healthcare provider, ensuring you stay informed and confident in managing your well-being.